We decided from the get-go, this is going to be a for-profit.
What are the biggest healthcare challenges in the Arab world today?
The thing that he started, writing word by word, millions of people reading through that content every day.
Because it's more than just content now.
You don't even have to have internet sometimes. You get this doctor.
More about your impact.
We went from 15,000 terms to 1 million. A Gazan father posted on Twitter and he just called Altibbi. It was free and he could save his son.
Jalil, welcome to Impact Talk. Hi everyone, and welcome back to Impact Talk, the podcast redefining success in business. Today, I'm excited to be joined by Jalil Allabadi, a visionary entrepreneur from Jordan and the co-founder and CEO of Altibbi, the leading digital health platform in the MENA region. Jalil's journey into digital health was inspired by his father, who created in 2008 an Arabic medical dictionary after recognizing the lack of accessible and reliable medical information online. In 2011, Jalil took this vision further, founding Altibbi to bridge the healthcare gap across the Arab world. Today, Altibbi is the largest digital health platform in the region, providing 24/7 telemedicine consultations, AI-powered health content, and a vast network of certified doctors. His mission? To democratize healthcare and make quality medical services accessible to all. Jalil, welcome to Impact Talk.
Thank you. It's a pleasure to be here.
Thanks for accepting the invitation. So, before we delve into Altibbi and all your entrepreneurship journey, I want to ask you to set the scene for our audience. What are the biggest healthcare challenges in the Arab world today?
Of course, there are a lot of challenges in our part of the world, unfortunately. Starting many years ago, my father, when he came back to the region, started working in refugee camps and in underprivileged areas. He was very concerned about the lack of knowledge about anything related to healthcare and medical awareness. And that's what inspired him and pushed him to start working on this medical dictionary. All doctors are trained in English or French in our part of the world. They're not trained in their mother tongue. And that really affects the way doctors communicate with patients and affects the way patients take control of their own health. So that's the fundamental issue that we have in our part of the world. The other thing that we discovered soon after starting Altibbi was that there are plenty of really excellent doctors in our part of the world, but the problem is that you don't have an infrastructure of primary care. So you have these excellent doctors that are specialized, working in highly specialized centers. And the governments are pushing and building and encouraging building these big, mega specialized centers, but you don't have very strong primary care infrastructure the way you have it in other parts of the world, which means that patients would have to go visit these excellent doctors for things that do not need these excellent doctors to be visited for. And that really puts a big burden on the healthcare system, on the population, on the economics of healthcare in our part of the world. So these are the things that we are seeing and we're trying to tackle with what we're doing.
Interesting. So language and primary care, I didn't know actually about that. So it's very interesting. And how Altibbi came into the picture and is actually filling those gaps?
So when my father found the first issue of the language, he of course tried to communicate with patients. He had studied in Germany, and the school of thought in Germany is for doctors to empower patients. And he tried to do that, but again, that barrier of language impeded that kind of communication. And that's what pushed him to look for other dictionaries to be able to communicate. He didn't find any dictionary that would translate from Arabic to Arabic. You have the dictionary in English to Arabic, diabetes is sukkari, but then how do you explain what sukkari is? How do you explain that to the patients? So he started working on that. That was in the 80s when he started. So he spent around 20 years writing that dictionary, compiling it. 20 years he wrote a dictionary that had 15,000 terms. He published it in 2008. That was the original aim, right, to tackle that language issue. When we went live with Altibbi in 2011, I had convinced my father that a dictionary is now outdated. Nobody's buying dictionaries, especially not patients. It might go to doctors, but not patients would not really go to a library and buy a medical dictionary. So I convinced him that we had to go online. So I did that, and in
to go online
2-3
with
years
the dictionary?
with the dictionary. So we digitized the whole content of that dictionary, and we wanted to become the WebMD of the Arab world, right? That I had discovered all these health lines and WebMDs of the world, and we didn't have anything like this in the Arab world, and thought, okay, we have the content here, we digitize it, and we make it into kind of a WebMD, and we called it Altibbi. And in the 2-3 years after launching the online, just to show the power of internet and the digital world, we went from 15,000 terms to 1 million.
Oh, wow.
And that's in a couple of years. And my father had spent 20 years to write 15,000 terms. So it's just a different world altogether. And the way that you can, you can give this knowledge to the people and share it with the people and empower them is really fulfilling. And it's really fulfilling to see that in my father's eyes when he sees now that the thing that he started, writing word by word in libraries, pre-internet era, and filling these cards and putting them together and then going to the publisher. And now you have millions of people reading through that content every day and getting the knowledge to deal with their own health issues. That's really, really fulfilling.
Very interesting. And then it evolves, I guess, because so it started by, putting online the whole dictionary, but today the business model is completely different.
Of course. We keep trying to follow patients' needs. At the end of the day, we always try to remember that people coming to Altibbi, we have about 1.5 million visitors coming to Altibbi every single day. These are not people coming to TikTok or Instagram. They're not coming for fun, right? They're coming to consume Arabic medical information. Can you imagine how boring that is? I mean, people are coming there because they have a need. They're coming there because they need to learn about something, about some issue they're facing, them or their loved ones. So we have to always try to understand what these issues are and try to solve these issues. What are they coming for? They want to consume content, but because they have an issue, then what is that issue? And how can we help them solve that issue? How can we get closer to solving these issues? We can't do everything, of course, but at least the more we move along the lines of helping these patients solve their issues, that's our mission. That's what we try to do every day.
So how are you doing it now, Jalil? Because it's more than just content now. We're talking about telemedicine. So now people through your platform have access to doctors. So can you explain a little bit more about that, how it works now?
Yeah. Today, in addition to the content, we have a free Q&A platform. So we allow patients from all around the world to ask questions for free, limited questions. And we have a huge network of doctors, specialists and doctors all around the world as well that are verified by us, validated by us. They come in and they participate answering these questions. It's like a moderated forum in a way, right? It's like Quora, but for medical queries, very moderated, very controlled. So that was our first foray into engaging our patients and our consumers. They want to ask things that are more than the static content that we are providing. And then we invited doctors to participate. It went on and on. Now we have about 4 or 5 million answered questions on this. And then from there, we ventured into more engaging with these patients. So they wanted to ask this question, but that's not enough. They wanted to have a conversation with the doctor, not only a question and answer. So we created our primary care telehealth platform, whereby patients can subscribe for very accessible fees and talk to doctors, primary care doctors, 24/7 in under 3 minutes. They just type what their problem is, and within 3 minutes, they have a doctor on the phone or on chat. We created it in an Uberized kind of model, so it's just to make it more understandable. But the idea is that we want to connect you with a doctor ASAP, and the essence of primary care is speed, it's convenience, and it's accessibility. We wanted to make it as accessible as a phone call. So you just type and we call you on the phone and you're connected with this doctor. We're recording the call, of course, for quality, etc. But it's a GSM call. You don't even have to have internet sometimes. Just call, you get this doctor. And it happens within 3 minutes. So you have that speed and you have it very conveniently and at very affordable prices. That was our main aim of launching that platform.
It's very interesting how it evolved, and it feels like you're using I would say today's, tools and, platforms, that exist to kind of build a community around the dictionary. And then, it evolves into more by listening to the community and their needs. It's very, very, very interesting model. And you mentioned accessibility to the healthcare system. So where do you operate right now in the region? In which countries?
So we operate all across the GCC. We operate in Jordan, in Egypt. Now we're getting into Syria and Iraq, and in Libya. We're already in Libya, and we're venturing into Algeria as well.
Do you see a higher adoption from people from underserved communities that have even, greater barriers, to access the healthcare system than, like big cities or, I would say, the people who have access to healthcare?
It's not necessarily only underprivileged versus big cities, because even if you go to Riyadh, for example, even if you have an appointment with a doctor, it's 2 hours to get to that doctor and 2 hours waiting in the clinic. So it's a lot of these factors that come into play when you talk about convenience and accessibility. What we can talk more about is actually more than big city versus underprivileged. It's talking about certain segments of the population. So, for example, women. They prefer to talk on a phone call with a doctor because it's for many reasons they don't feel comfortable visiting doctors who are mostly males and talk about certain issues. You can talk about emergency situations, like having a feverish child at 4 a.m. and you don't know what to do, so you call the doctor. So a lot of use cases. When we talk about underprivileged, definitely it is a very important use case. I'm not saying that the adoption is higher there, but the impact is higher there. It's a different way of looking at things. The impact is way higher when you talk about underprivileged communities. And the impact is beyond only having access to the doctor. That's one aspect of it. But it goes beyond that because it also affects the economics, right? Patients would have to go. A lot of the patients in the underprivileged communities don't have insurance. So if they go to the doctor, they'll have to pay out of pocket. That's affecting their economics, their survival in some ways. So any visit means a lot. If you can provide them with accessibility at affordable prices, that affects their life beyond only, getting the answer or the diagnosis for some issue. In many areas where we worked in Jordan, we worked with underprivileged women in underprivileged communities. The work they do is temporary all the time. It's daily work. It's not like they're not employed in full-time jobs. So any day they lose not working is a big issue. And having a doctor means that they don't need, if their child, for example, is sick, they don't have to go to the next city, waste a day or two to see a doctor to solve that issue that they can now solve in 5 minutes and continue their work. So again, it not only affects them not spending money, but actually making more money. So a lot of aspects come into play when we talk about underprivileged communities and healthcare. It's a big topic now, actually. There's a lot of studies are coming about the impact of healthcare on finance. Now it's the talk of the town.
And you fill in multiple gaps actually in the current system. So it's very interesting how people are using also the platform and for very different reasons. You talked about impacts. We are on Impact Talk. Can you tell us more about your impact and any success story that you could share with us?
Sure. I mean, impact, again, as I mentioned before, it is part of our DNA, right? So my father did this because he felt the need for this, and he saw the need in the refugee camps and in the underprivileged areas he worked in as a doctor. So it's baked in what we're doing. We did this because we wanted to impact. And there are a lot of stories. I mean, we get testimonials. We call them testimonials, or they're just letters or emails or WhatsApp messages from users who are thanking us and thanking our doctors for helping them, helping their children. So that always fills us and the team with a lot of happiness when you see the impact. But yeah, some of the things we did, again, a lot of these initiatives actually also come from the team because they live this. So it's not necessarily saying, we have to have an impact there. It's just things like, whenever there's a crisis in our region, we're always there to provide free access to doctors immediately. And we did this in Lebanon when the port, the explosion of the port, in Syria with the earthquake, in Gaza. And one of the most touching moments of my life, I think, was a message, a post, a Gazan father posted on Twitter. That was, I think, in the last war in 2016. He posted on Twitter thanking Altibbi because he couldn't reach a doctor. There was bombardments everywhere. And he just called Altibbi. It was free, and he could save his son. So that was a very touching moment for us and the whole team, that we actually can touch people's lives. Really, it's not only an online service, and you get stuck sometimes with the jargon, but you actually touch people's lives in reality.
Amazing, Jalil. Talking about AI and technology, I want to touch upon that because you use AI at Altibbi, and I want to have more insight from you on how do technology and AI have the power to enhance healthcare accessibility in the region.
Yeah, I mean, AI now is a nice hot topic, right? So everyone talks about it, but we actually have a testimony that we have been doing this before it became a hot topic. So
when did you start actually implementing AI?
We started just during COVID, actually. Okay. That was for us, the moment that we realized we had to invest in this. It wasn't a choice. We had to. Back then, we were asked by a couple of governments, mainly Jordan and Egypt, to launch COVID hotlines. If you remember, there was a lot of panic around what COVID is and a lot of misinformation, and people wanted just to go to hospitals and test, and there was a lack of kits at the beginning. So we were asked to create these lines and immediately tackle that issue. So we created I remember the hotline in Jordan in under 8 hours. It was up and running. And I remember having that call from the minister asking me to do it. And I asked him, how many calls do you expect us to have? Just to prepare the doctors and the lines and everything. And he said, around 500. We launched at 5 p.m. and by midnight, we were at 5,000. It was going crazy. And, we had to get doctors. And we had a pool of doctors, and we always have pools of doctors that are pre-trained so we can manage ups and downs. But that was something that we had never anticipated. From 500 to 5,000, there were two solutions. Either we slow down until we train doctors a proper way, manual way, and go through the policies, and that's a lot of time. Or we invent the tools, create the tools that would make doctors be onboarded much quicker and deliver the same quality as a doctor who has been trained for a longer time. And that was our foray into AI. We started creating these tools for doctors to, just after the call, it shows the diagnosis, it shows the symptoms, and the doctors just have to fill and they have to give the right information. And the summary gets pre-filled by the AI and all of that. It helped a lot. It helped us scaling without a glitch. And actually, we then just right afterwards, we were contacted by Harvard, and they wanted to write a case about how we are deploying that AI. And it was published actually as a case study for Harvard. They called it how to revolutionize telehealth with AI. It was the first case about telehealth, and AI was written about Altibbi. So wow. That was the way we did it. Patients didn't feel it until now. They don't see it because it's in the back end, but it helped us in many ways. And when we talk about impact, the impact is huge because it allowed us to lower the cost per consultation. Doctors can now have more consultations per hour, so the cost per consultation per doctor is lower, and that allows us to also make it more accessible, more affordable, and at same quality. So we're not touching quality. Quality for us is paramount. This is medical. You don't play with quality, but you play with everything else, and you try to deliver that to the patients. That was the beginning. Today, what we're doing is, on top of these great models that are coming up left, right, and center, we created a model to basically deliver our content in a conversational manner. So instead of doing the typical search and going through articles after articles in a very, I would consider now, very antiquated way of doing or navigating the internet, now you can just chat with our content. So you have, when I talk about diabetes, instead of reading these pages of diabetes with a billion things, you can ask the things that matter to you, and you get the information that matters to you in a very meaningful manner. That's a new thing, and we're building a lot of tools on top of that so that the content can become a concierge for you. So instead of having content just to read, now content is for you. It's there. It's interactive. It can actually guide you through things. It can ask you questions and deliver content that is even more and more meaningful and personalized to you.
Interesting. And do you think it has the power to kind of revolutionize the healthcare system? Do you see any big changes coming up?
There are a lot of changes that will be coming up for sure. Depends on how regulators are going to adapt to all of this, and how doctors are going to adapt to all of this. But I think patients are already there. They're using it. And when I talk about our content, AI content, we launched it 6 weeks ago, so not far off, so only 6 weeks ago. Now we have just yesterday completed 1.5 million sessions on it. Already 150,000 people registered to use it in an unlimited way. They have, I don't know how many millions of conversations back and forth. It's crazy. People are just using it. We were talking yesterday with the team about some users who crossed 4 hours of conversing in the system. It's like, what are they? But again, these people are in need. So definitely they're not having fun. They're just checking. But this is the amount of engagement that you can get when you deliver the content and in a way that people want to engage with, so they can ask and ask and ask and learn and learn and learn. This is the whole thing. So patients are there. They're using it. The more technology you give them, they want it, because again, we lack a lot of things in this part of the world. So the more is better for them. But how will it affect doctors? How will it affect hospitals? This is still to be seen.
And it comes at the right moment for you because, you spent years building the database, initially with the dictionary and, all the contents. And I feel, my feeling is that like AI is just a natural next step that, really empower even more the patients to, look for the information that they need. So
Absolutely.
it's amazing for you.
Absolutely.
In our first conversation, Jalil, you said to me something that was surprising, that you did not categorize Altibbi as a social enterprise or, impact-driven, company. And when I think it was the Schwab Foundation that contacted you, I don't know, to support you and showcase the work you do, you were quite actually surprised by why Altibbi was selected. Can you tell us more about the misconceptions that perhaps you had at that time about social entrepreneurship or impact-driven business in the region?
Sure. I mean, when we started, again, it is part of the DNA. So I like to keep remembering that, and it has always been doing well by doing good. It's part of our DNA and everything we do. But when we decided to launch the company Altibbi, we decided with my father, this is going to be for-profit. We want to make money out of this. And the money is mainly to sustain the company. We don't want to live off charity. We don't want to live off grants. And this, we decided from the get-go. And it was a difficult decision, but we had to both agree this is going to be a for-profit. And we did it as a for-profit company. And we treated it as a for-profit. We raised venture capital money, and we always went with that, of course, again, we wanted to give accessibility to the patients, but at the same time, we wanted to get money. We wanted to monetize from advertising, then from telehealth subscriptions, always with a thinking of that profit and the margins and all these financial things. When I was contacted by Schwab, I was shocked. Because for me, when you talk social, it is those people who take money, who live off grants, right? It's different from us. We are taking money, we're making money because we sell things. We're not living off grants. And so it's not an NGO. It's not something. And that was, for me, the misconception that if you are social, then you can't make profit. And they explained it to me, like, yeah, you can be profitable. Important thing is that you're delivering impact at the end of the day. If you're thinking about that and you're doing it on the ground, you can be profitable. You can think about financial gains however much you want, but you can still be a social enterprise. So that was the changing moment in my life. Yeah.
Interesting. I don't think you're alone. Having this perception that a social enterprise or an impact-driven business is try to combine profit and purpose, and that profit and purpose go hand in hand, and it's not. You don't have to, be a non-profit to do good. Yep. You can, build a social enterprise or, any other type of business that just as you said, at its core, impact.
That's right.
And it's not bad to make money.
It's not bad to make money.
Yeah, but that's I think it's it's the general.
It is a misconception, though, right?
It is.
And I feel it until today, even from the other side, like from the NGO people, when I'm among them, like, what are you doing here? You have taken money from the bad guys, from the VC guys. It's as if making money is bad. So it's on both ends. It sounds like there is this Chinese wall between. It's not true.
Things are evolving. I think things are evolving. You see, the rise, not much here in the region, but what we call impact investing. Mm-hmm. So investor that, take into consideration the risk, the return, and the impact with clear, impact goals and measurements. So I think it's we're gonna see more and more of them, I hope, in the next couple of years.
Hopefully.
And things, are slowly evolving. Even, on the non-profit side, when I talk to non-profits, they tell me like to sustain, ourselves, we cannot only rely on, grants and, donors. We have also to set up, social enterprise, non-profit with a social enterprise that can, generate revenues and that can help us to sustain the whole organization.
Exactly.
So things are really, really evolving. Yeah.
Agreed. We have to widen the definition of impact, because if you think about it, there's a lot of impact even from not directly impactful organizations. If you think about it, but companies create jobs. When they become rich, they can become philanthropists. There's a lot of impact in creating companies at large. So it's something that helps people, helps economies. Definitely having a purposeful kind of idea in the company, or a purposeful vision of the company, is always something that we need to encourage companies to adopt. So we were talking about this earlier. But at large, I do feel that this definition of impact was very tight, or is very narrow, and now it is widening. And the wider it is, the better it is.
Yeah, I agree. And I think our also understanding of impact also is evolving. And what you see also, it's very interesting, especially with SMEs, when I have discussions with them, is that they're already making an impact, but they are not able to connect the dots and, give it like a proper framework, I would say. But there is no company that starts from scratch that is only, super profit driven. There's always things happening, but naturally, as you did.
Most of these entrepreneurs and these companies are born because out of problems that these people were facing, and they wanted to solve them, right? So they're trying to solve issues faced by the communities. Some are trying to solve food delivery, but some are trying to solve things that are more drastic and more problematic for our planet or our communities. But everyone is trying to solve a problem. That's the definition.
So the scale of the problem.
It's the scale and the depth, if you want. But it's always a problem that they want to solve somehow.
Amazing. Thank you so much, Jalil. I really love the story of Altibbi and all what you do. It's fascinating, and we never actually had on the podcast the topic of healthcare, and health tech like Altibbi. So it was a real pleasure to have you with us.
The pleasure is mine. Thank you very much, Nadine.
So thank you for tuning in until the end. Please don't forget to subscribe to YouTube or on the podcast platforms to support us, and also please comment and tell us what you think about these episodes, and stay tuned as usual for the next episode.